So my name's Karen Swift, and I'm one of the advancing practice supervision and assessment leads here in the Midlands region, working for Health Education England. So we're hoping this afternoon then to focus a bit on how to facilitate effective supervision for advanced practice. And we're aiming this session at kind of employers, AP leads and organisations and training hubs, ICSs and HCIs. So this is hopefully going to complement the new guidance around advanced practice supervision and our minimum standards, and we will be sort of referencing this documentation throughout the session. Next slide, Sarah, please. My technical support. So we know that advancing practice is not new, but there has been sort of a lot of significant changes and increasing focus and innovation over the last few years, really, about how it can enhance and enable transformations of pathways of care. So we've got the National Centre for Advancing Practice, as you can see on the slide there, and then our 7 regional faculties throughout that, and we're obviously in the East Midlands here. So we work very closely with the centre and the other faculties as well to sort of best understand the needs for our learners and what our patients need, really, and looking at our population health. So if you move on, please, Sarah. So as I've said, I'm Karen, one of the regional supervision and assessment leads here, and I cover mostly the East Midlands. I've got my colleague Sarah Meenan on the call as well this afternoon, who will be presenting shortly. So Sarah covers the West Midlands, and we've got Heather here as well, who's our regional faculty lead for advancing practice, and also Halima, who's helping us out with all the tech and doing lots of other wonderful things for us this afternoon. So that's a team on the call today. Next slide, Sarah. Okay, so today's session then, we're going to focus really quite closely on supervision for advanced practice training and revisit some of the fundamentals that were outlined in the workplace supervision for advanced practice guidance. It's been out quite a while. We're then going to look at the much newer minimum standards for advanced practice supervision, and then share some of the resources that we have available, and so we're going to hear a bit from others in region as well who are using their supervision funding a little bit differently, perhaps, that might give you a few ideas. There'll be a chance to ask questions. Do sort of pop anything in the chat as we go along, but there will be an opportunity to ask questions from all of us at the end. Please do share the information that you get today as well, and perhaps sort of raise the importance of supervision, because we know it's a crucial element. You're all here obviously because you're interested in supervision, so we really want to get out there and spread the word, by sort of developing good effective supervision. Then we're keeping our practitioners safe, competent and capable, and then we're also ensuring that governance is in place as well to guard both our patients and our practitioners' safety too. Thank you, Sarah. I shall hand over to Sarah now.
Hi, hello everyone. We're going to talk a little bit about the 7 fundamentals of advanced practice. So the Workplace Supervision for Advanced Clinical Practice document was launched in October 2020. The work was commissioned to look at the supervision in the multi-professional advanced clinical practice. To note, when it was commissioned, the brief was advanced clinical practice to align with the 2017 HE framework for multi-professional advanced clinical practice. However, we recognise that, and it is acknowledged in the publication, that in some practice contexts, the term advanced practice is preferred, and the guidance is relevant in both contexts. For the purposes of this session, I'll use the term advanced practice to include all contexts. Within the workplace supervision document, 7 fundamentals for supervision within advanced practice are identified, and these are the practice contents, competence and capability, the contribution of multi-professionals and their registrations, the need to attend to individual learning needs, issues of the professional development and transition practitioners developing to an advanced level, the need for an integrated approach to supervision given the breadth of development across the 4 pillars, and the development of supervisors. Importantly, it is essential that these fundamentals are considered at the very beginning of workforce planning, and that supervision is included in the business cases and job plans ahead of recruitment, and not just as a desirable add-on. And why is this so important? Well, because good quality supervision is the cornerstone of both professional and public safety in practice. So with these 7 fundamentals in mind, we're forming the basis of the guidance on how to operationalise supervision. It's worth looking at the minimum standards in a bit more detail to understand what good practice, good governance and good organisational strategy looks like in terms of supervision for advanced practice. It's important to say at this point that there is an absolute minimum expectation of what is needed and should be seen as a starting point for developing an excellent supervision framework within your organisation. The guidance document uses the 7 fundamentals of supervision and sets the minimum standards that should be integrated into an organisation's advanced practice governance to meet these. And these are outlined in the blue boxes throughout the document. The document itself is designed to be concise, accessible, and hopefully very easy to navigate. If we look at one of the boxes in more detail, you can see how it relates to the workplace supervision document. For example, we've already discussed the uncertainty and difficulties that can be experienced when a professional transitions into advanced practice and how the advanced practice context and competence and capabilities required for the role need to be considered. So as an absolute minimum before supervision should be mandatory, with a supervisor identified before the start of the advanced practice training in order to support the transition and scheduled with the trainee and the supervisor's job plans for a minimum of an hour a week. It is really important to remember that in some practice contexts, such as allied health professional or a nurse running independent clinics within a GP practice, for example, that it will be necessary to debrief and provide daily supervision to ensure patient and practitioner safety. As I've already mentioned, it's unlikely that one individual will be unable to support a developing practitioner or trainee with supervision across all the pillars of advanced practice. You may need a number of different supervisors to effectively support the clinical, education, leadership management and research pillars. The coordinating supervisor must be an experienced practitioner who can provide a consistent relationship through the period of training and who has an in-depth knowledge of the advanced practice role within the specialty. And if the coordinating supervisor is themselves an advanced practitioner, it is advised that they should have been working in the advanced role for a minimum of 3 years before taking on a coordinating supervisor role. The associate supervisors will collaborate closely with the coordinating supervisor and will have an expert knowledge in that area they are supervising. It should also be noted that there may be existing standards for supervisors within some established curriculums, and that should be followed. This guidance is aimed for those practice areas where there's an absence of a framework or curriculum to guide advanced practice development, and supervisors should have some formal training before starting to supervise a trainee. Hand you back to Karen.
Okay, thank you. So Sarah's just mentioned then that it's advised formal training for supervisors should be a minimum standard within good organisational governance for advanced practice. So part of the ongoing work within the faculties is looking at what sort of supervision training is already available out there, and we're working quite closely with our HEIs and organisations to help identify what's needed in terms of supervision training for advanced practice. So, you know, this is very much the next focus of the work being done by all of the supervision and assessment leads together. There's already sort of a wealth of resources available for organisations to use to support supervision training that's appropriate for their setting, sort of as the educational supervisor training and roadmap supervisor training, but obviously they're sort of dependent on the areas of practice. So recently, Sarah, can you put the next slide up, please? There we are. So recently here in the Midlands, we've been running a supervision pilot along with a London faculty. We've taken some of the work that Julia Taylor's been doing with the roadmap supervision course and taken it out of primary care to see how it would work in other settings. So it's been running now from July, and we've just finished the second day of our final course here in the Midlands. So why did we do it? Well, we know there's a need for a quality standard of supervision to support advanced practice. The roadmap supervision stuff was already mapped to GMC requirements for the FCPs and advanced practitioners in primary care. So it seemed sensible to use that model for the pilot, since that kind of governance and regulation was already in place for that. Both regions have had 3 cohorts across the pilot period. We're looking at the evaluations now as they're coming in. We've just got a bit more to come back on the Midlands from our last course, but we had a pre-course evaluation as well to sort of gauge where people are at, what sort of supervision training they'd had previously. We've done an immediate post-course evaluation as well on the day. There's also an evaluation that goes out 6 weeks later, when those people who've been through the pilot have had time to go back into the clinical areas and have a little sort of think about how they've used some of the principles that they've got during the pilot as well. So, and hopefully that evaluation then is going to feed in to the national work that we're doing, where we're looking at the next steps for supervision training for advanced practice. It's, you know, it makes sense. We've got more and more trainees coming through, so we know that we're going to need more and more supervisors. So we've really got to think how we're going to ensure that they're up to standard, really. We also need to think again about, yes, we're putting people through courses, we're giving them resources to use, but how are we going to maintain that supervisor competence as well, you know, and is this Health Education England's role to do this, or do we look at sort of external sources to help us with this? So some of the early stuff that is coming out of the evaluation so far, and we know from how many people tried to get onto the pilot, there's a real need for using some of our qualified advanced practitioners to be supervisors as well. I think the most valuable thing for most people who've attended has been the stuff around the feedback and the debrief and how to manage those situations. And people have also felt that it's given them a real awareness of the different multi-professional roles that are out there and how supervision varies between those two, and all the different professional backgrounds that we've got that we really need to be considering as well when we're committing to be supervisors for advanced practice. London had medics on their courses as well, which we didn't in the Midlands. We stuck to just qualified advanced practitioners. So I think it's going to be quite interesting to see what the evaluation comes out of between the two groups. It's been quite apparent that we need some sort of forum across region nationally. We've not really sort of got that far yet, but there needs to be some sort of community practice or supervisor forum as well that people are really keen for, where they can share experiences, discuss things with their peers and colleagues, and use each other for advice. I think it's really important that we at HEE do something to sort of facilitate that network going forward, and I think it's going to be quite fundamental to supervising advanced practice in region as well. Thank you, Sarah. So in the original workplace supervision document, Appendix 6 kind of gave us a bit of an outline around what should be included in supervisor training for advanced practice. Obviously, you know, an overview of what advanced practice actually is, particularly important if we're using people from outside the advanced practice group to come and supervise our trainees. Clearly, we need to think about the multi-professional element as well, and who's the right person to perhaps be supervising the multi-professional group as well. Who's really going to understand these advanced roles in sort of different, perhaps sometimes quite niche areas, and that might mean that we need to open up our supervision a bit more and work perhaps across region a bit, but hopefully all of this will come out in the next piece of work. We obviously need to think about exactly what supervision is and different models of supervision we can use. Where can these be adapted? Are they the right models for your area? We need to think about how we're going to get these skills, the different learning theories behind this, and then really sort of breaking down how we use critical reflection. Of course, governance is always going to be a high priority in all of this as well. So where do our supervisors fit in with this? How does their training mean that they're fit for purpose, and we've got that assurance and governance there? And really important as well, that professional well-being as well, you know, not just for our trainees, but we need to think about our supervisor well-being too, and make sure that that's incorporated into our training. We want our supervisors to be able to look after themselves as well as their trainees. So thank you, Sarah. So there was already a few resources out there. As I mentioned, we're looking nationally at how we take things forward and putting some sort of repository together that will be available for people to come in and sort of pick and choose which bits of supervisor training are going to suit their particular organisations, but there are a few bits and pieces out there as well that are quite freely available, excuse me. So there's some e-learning for health as well. There's some nice videos as well on the Health Education England site, as you can see there. And obviously this is being recorded and the slides will be there as well to reference. So you can go back in your own time and have a look at those, some quite useful videos on there that map into it too. Like I said, eventually we'll have some nice resources on there as well. Okay, thank you.
So in addition to support supervisor readiness to supervise, we've produced a checklist that's recommended supervisors complete before they agree to take on the role. The checklist can be found at the end of the guidance, and we've also got an editable Word document that can be found. The checklist allows potential supervisors to self-assess their own readiness to supervise a trainee advanced practitioner, and helps them identify any gaps in their own knowledge and understanding of advanced practice supervision requirements. We're often asked what is the amount of supervision needed by a trainee advanced practitioner, and this is really dependent on the stage they're at, their personal learning needs and the practice context. Creating a routine for supervision early on helps to establish and embed good working relationships between the supervisor and the supervisee. The first meeting with the coordinating supervisor should happen at induction or earlier if possible, and it's when the supervision schedule and plan can be agreed. There should be a minimum of 1 hour per week through training, although this does not always need to be with the coordinating supervisor. It can be with one of the associate supervisors with a focus on a particular area of practice. Nevertheless, trainees should meet with their coordinating supervisor at least once a month. If the trainee is following the apprenticeship route, the supervision should happen with the 20% off the job learning. At the first meeting with the coordinating supervisor, the scope of practice and curriculum for training for the role should be discussed. This is when the supervisor can gain better understanding of the practitioner's existing competence and capabilities and what is needed to be developed for the role. This is effectively a learning needs analysis, and this can be done using a formal framework or by asking the trainee to map their capabilities against the requirements of the role. The completion of the learning needs analysis is seen as a minimum standard and will allow for a comprehensive and personalised learning or action plan to develop the practitioner safely and effectively. It can be helpful at this stage to consider completing a learning contract that sets out expectations and boundaries of supervision and to agree the schedule for supervision. It's also important to ensure that the expertise and knowledge of the Higher Educational Institute is used to provide a well-rounded support for the trainee across all the pillars of practice and academic progression. This can be through tripartite reviews, supervisor training, AP forums, online resources, and so on. It's worth connecting with your HEI to ask what resources are available to support the supervisory relationship in practice. So the success of the supervisory relationship is dependent on both the supervisor and the trainee engaging in the process. To do this, the trainee should actively contribute to supervision, seek feedback, and recognise their own development needs. Trainee advanced practitioners are experienced professionals within their own right and have a professional registration already. As I've already mentioned, the transition to trainee can bring its own challenges and require a significant adjustment from going for expert to novice again, and the learning of a whole new set of skills to extend their scope of practice beyond the traditional boundaries of their profession. So to support their own transition to advanced practice, the AP trainee should be appraised of their own scope of practice and responsibilities as a registered practitioner, actively contribute to supervision, work in partnership with their supervisor to negotiate and agree a learning plan, to address performance and support enhanced learning opportunities. And they can complete a readiness to become an advanced practitioner checklist to help them identify learning needs. And this is something else we've developed to help support the trainee with the transition to advanced practice, a readiness to become an advanced practitioner checklist. Similarly to the supervisor checklist, this should be completed before the trainee takes up the post and will give them time to reflect on their competence and capabilities in relation to the role and ensure that they have the correct support mechanisms in place to facilitate their progression. Employers can also use this checklist as part of their recruitment and selection process when planning new advanced practice roles. The final resource within the minimum standards document is an action plan template to help employers with developing a robust supervision strategy for advanced practice within their organisation. This summarises the recommended minimum standards for supervision and guides employers to think about what is already in place and what needs to be developed to enable high quality supervision for advanced practice. But it's important to remember that supervision for advanced practice should encompass all 4 pillars of advanced practice. We're generally good at looking at the clinical pillar, and this is often a main area of focus. However, there should be continued opportunities for supervision across the 4 pillars. As we've already discussed, it's unlikely that a person will be able to support the depth and breadth of knowledge and skills needed to supervise their AP trainees fully against all of the pillars, and this is where the associate supervisors would be beneficial to support this. There are also opportunities for the practitioners in other trusts and roles and environments to support trainees. Thinking outside of the normal practice to enhance the learning and support for our trainees offers the opportunity for them to gain the supervision required to support practice across all of these pillars. Another great resource is the maturity matrix. Credible governance of the processes for developing and implementing advanced practice in health and healthcare provider organisations is central to safe, effective and successful employment of advanced practitioners. The maturity matrix has been developed to help assist healthcare organisations across all settings, and they can formally self-assess their progress on the governance of advanced practice against each domain, which will then indicate whether they are making either early progress, substantial growth, or are mature in the governance of advanced practice within their organisation. It's not mandatory, but it is an iterative, developmental, formative activity to help organisations understand what it is that it needs to be doing to successfully implement advanced practice governance and how you are progressing on doing that. The matrix represents 8 themes, each with their own set of associated aims and underpinning criteria, representing the graduations of maturity in an organisation may align to, and in regards to the governance that sit within that frame. If we look at the supervision theme, you can see the progression from early progress to mature organisation and what needs to be in place to do this. And along that lines, and to support the supervision, the Midlands region has recently been in receipt of supervision and assessment funding, which is starting for all trainees from September 2022, so the current trainees and those going forward, and it's £2,600 per trainee commencing from September. And it's for commissioned trainees, apprenticeships and top up to advanced clinical practice masters. The funds will come in 3 instalments. For this year, the first of those instalments will come with the education contract, and from the September period will be a shorter amount of money because it's related to the financial year and not the academic year. And then there'll be a second wave with the January payments. So we are going to talk to some people from different places. I'm just seeing if they are here yet.
Jen was coming around 1:30 because she's clinical today, so she was just going to hop on to do her bit. So we just got a couple of minutes for her. I'm not sure if James has been able to be released from NUH either, so we'll hold off. He may well do, but if not, I can fill you in on some of the things that they're doing at Nottingham.
And we've got Saj on here as well, who's going to talk to us about a little bit about what's going on at Sandwell and West Birmingham. Hello.
Hi, good afternoon. How are you?
Good, thank you.
Thank you. So I haven't got much to say. So I've got a couple of slides there to share.
Yeah.
Okay. You see that?
Yes.
So good afternoon all. Just going to briefly talk about things that's been happening in Sandwell and West Birmingham. So the first thing that has happened is that we published our advanced practice framework last month, which is the operationalization of the minimum standards guidance published by the faculty and the supervision documents. So it's taken from that and is the operationalization of that. In particular to the clinical supervision, our framework is now asking to provide 0.25 SPA time per week per trainee AP. That is 1 hour built into their job plans, and 0.125 SPA time for the qualified advanced practitioners. If a coordinating educational supervisor or advanced practitioners, they must have been qualified for at least 3 years and completed approved educational supervision training. Because of the limited availability of the educational supervision training, so what we're asking is to complete the supervision training available on e-learning for health, the multi-professional supervision training. And this framework has been approved by the senior clinical leadership executive, and now the job is to operationalize these recommendations from the framework. We also given access to practitioners e-portfolio for all trainees in Sandwell and West Birmingham to complete the portfolio of evidence, which cost about £99 per trainee. So we're hoping that we can use that money from the supervision money that is starting to provide from the faculty. I also met with the supervisors of trainee ACPs, and most of them, and it's still ongoing process. What I came to know is that there is a lack of understanding of the supervision needs of the trainee ACPs within the consultant body or the supervisors. So having these conversations as a help to them to understand the needs, and our trainees are getting more supervision nowadays. And the electronic portfolio and the requirement of the workplace-based assessments, all these are coming into action now. We're also recommending the non-clinical time of a minimum 3 hours for all qualified ACPs, advanced practitioners in the trust, because some areas that we're getting no non-clinical time or SPA time, and some areas we're getting more. So now trying to standardize as a minimum requirement of 3 hours, which can be used to meet the other 3 pillars of the advanced practice. What we also been doing was we established the Sandwell and West Birmingham Advanced Practice Academy. Like-minded colleagues came together and we established that. So, and we delivered study days and organized the future study days as well. The first of its kind was the intensive ECG course of every 2 weeks, 6 sessions, and it's about to complete in early December. The first batch is going to complete in early December. We also delivered all-day study days. That is a monthly study days which start in October. The first one was a respiratory study day. Second one, cardiovascular study day, was in November. And in December, we're going to have a cardiovascular study day, second part. And from February, March is a gastro. So every month we got a study day, which has been well received. And it's been delivered by a mixture of ACPs, ACCPs, and the consultants from cardiology, consultants from respiratory. And these are some of the feedbacks which we received from the study days, which we given or done in the last 2 study days. We also opened the study days to one of the neighbouring trust or trainee ACPs from one of the neighbouring trust as well, and it's been very well received. So we're hoping that in future we may be able to accommodate more people if we have a capacity on that based on this. So these are the little things that's been happening in Sandwell. Happy to take any questions if anyone have any.
That's brilliant, thanks, Saj. It's really interesting, the work that you're doing there, and the study days that we've got. I'm not sure if we've got any questions now, or if we'll do some questions later, unless anything's come through.
Nothing that's come through just yet, but we'll pick up any questions at the end, I think, if that's okay, Saj.
Thank you.
Thank you. And next up, we've got Jenny Riley from United Hospitals of Derby and Burton to tell us a little bit about what they're doing over there. So thank you for joining us, Jen, taking time out of your busy, no doubt, clinical day.
Yeah, it's a little bit busy here. It's a realm of DVTs today, it feels like, but hey ho.
We'll try not to keep you too long.
It's fine. I'm more than willing to come and talk, and it's really great to be able to share what we've been doing at UHDB with the wider Midlands team. So I'm Jenny Riley. I'm Associate Director for Advanced Practice at UHDB. I'm also TPD for Acute Care, working along Sarah, Karen and Heather, who were facilitating the session within the centre. So here, oh no, I've got to do next slide, haven't I? So when we think about supervision and assessment at UHDB, we thought about some of the, I thought it would be useful to talk to you about some of the challenges that we felt that we were facing in supervising our ACPs generally. So I think the pictures represent the thoughts that we were having and where the challenges were. So I think that top right, my left, maybe you're right, I'm useless, I'd never make a surgeon, picture depicts the fact that we are seeing so much supervision burden now out there in our healthcare settings. It's not just our ACPs, it's our doctors in training, our undergrad nursing, physio, radiology students, the increase in non-medical prescribing, which has a big impact on supervision needs. So it was thinking about how we could maybe do things a little bit differently and not just continue to put all that supervision funding into one basket and send it out to the divisions, but actually would we be able to improve our quality of supervision, but also share that out a little more equally. Retention of our staff is really key. We're quite lucky at UHDB. We're more mature in our advanced practice journey. So we are now finally flipping our numbers of qualified to trainee ratio. And we're at that point where we're almost more qualified now than we are trainees. So retaining our qualified ACP workforce was something that was really key for us. And so we thought about, actually, is there some opportunities within the supervision funding that we've been given to create some opportunities for our qualified ACPs to give them a little more of a portfolio career and something a little bit different than that front coal face of clinical practice day in, day out. There were some thoughts around quality, and certainly we run a clinical and academic review of progression panel annually for all our ACPs within UHDB. And what we were seeing was that some of the quality of the assessments that were coming through weren't great. People were getting supervision, but actually was that quality supervision, or was it just a box ticking exercise that you've done a CBD and you've been assessed as being exceeding expectations, but then actually the plan is just to see more patients? That's not really the supervision experience that we're wanting for our trainees as they're developing. The person asleep on the books, I think, is all our workforce currently. Everybody's tired. We've all been through the pandemic. It's been a hard few years, and it doesn't look like there's going to be any let up. The supervision takes a lot of time of individuals, and we needed to make sure that we weren't overburdening any one particular group of supervisors for our ACPs in training, and also those qualified. And then the final thing that isn't a challenge, although it's on here, I think it's very much an enabler, is the HEE, the Centre for Advancing Practice Workplace Supervision Standards, because that actually gives us that lever to say, this is the standard that we need to be meeting. We need to be providing this level of supervision for our ACPs throughout their training, and here's the rubber stamp to say this is what we should be doing. Next slide, please. So what were our solutions? So our first thing that we put in place, our first solution, was to actually embed education leadership within our ACP team. So we created a host of support posts within our ACP leadership team. So we have our divisional ACP leads who oversee the divisional operational leadership of their workforce in their areas. But we thought that actually that's quite a big job, and there's lots of other things that our ACPs need support with as they go through their training journey and post-qualification. So education leadership was one of our strands of our leadership team, and we have two qualified ACPs in that role. We have a nurse who happens to be Karen, and we also have a physio, Chris Smalley, and that blend of the two professions is working really well, I think, because we are so multi-professional. It brings that different perspective to the conversations that we're having around education, a broader understanding of how we train in our base profession and how that might influence some of our training needs going forwards as we develop into advanced practitioners. Some of the stuff that the education leadership team are responsible for are our annual review panels for our trainees. In training, everybody's portfolio is submitted annually, and they will go through initial review by their divisional leadership, ACP, and then it will be brought to panel, and any concerns raised around that individual's progress, where they are in their training programme, can be discussed as a panel, and potential solutions, support packages be put in place there. They also look at the quality of the assessments, so that's kind of where some of that quality came out of it from the first slide, in that yes, people are getting these assessments, but they're not actually great, so how can we make this better? And they also are responsible for delivering our education package across the year for our ACPs, both in training and qualified. What we've noticed is that we're trying to deliver a slightly higher level of lunchtime training sessions, so that actually our qualified ACPs also feel like they've got something that they can access and feel challenged from when they attend those sessions. Supervision and assessment roles. This is something that we've done more recently with our supervision funds, and how we've done this is we've utilised our funding from HEE, so the 2,600 that we've got from HEE per practitioner in training, we've put that into one big pot, and out of that pot we've developed our supervision and assessment roles. We've basically calculated that we'd got enough for a whole-time equivalent, but what we've done is split that across several of our qualified ACPs. So again, it goes back to that retaining our qualified staff. It gives them something that they're interested in, something that's a little bit different, and gives them their opportunities to practice across all of those 4 pillars. Our supervision and assessment roles come from across the divisions, and they again are multi-professional. So we've got a paramedic in there, nurses, physio. I'm thinking physio. Yeah, Karen's nodding her head at me. Thank you, Karen. And these are guys that have been qualified for around about a year now, but the work that they're doing is going down brilliantly with our team. So they do roaming supervision. So they will put dates out to the team and say, if you want me to come and work with you and do a ward round with you and supervise you for a day, and do a broader assessment, that's fine. If you just want me to come and do a couple of CBDs with you, brilliant. If you've got a clinical skill that you need to get signed off for, let us know, we can come and do that. And they do that in situ, so it's not removing that trainee from the clinical workplace, they will go to that clinical workplace. They're doing some more bespoke supervision for some of our trainees who might have some difficulties, and they're picking those individuals out and putting in some bespoke packages to support them through their training. And what they're also doing for our CDM, so that's our health assessment module that we do at the University of Derby, they do lots of wraparound support and teaching and training sessions for that. So that's going down really well as well, because we all know how anxiety-provoking OSCEs are, particularly if you haven't done one for a little while. But what we've also done for the OSCE preparation session is we've opened that out across the system. So any of the trainees that are doing their health assessment at the University of Derby are welcome to come and join our OSCE training sessions that are led by our supervision and assessment roles. Anything else that I've forgotten there, Karen? Because you're probably a little closer to those guys than I have.
I don't think so, no, but just they're keeping a spreadsheet of every little bit of supervision that they're doing, and it's ridiculous. I think something in the first couple of weeks clocked up about 120 hours between them all of hours of supervision that they were giving our trainees, which is just fabulous. So it's really good. It's working brilliantly.
And then the final piece of the jigsaw here is our practice support and wellbeing lead. So this is a experienced ACP. She is a nurse by background, but she came from a matron role, so she got a lot of the background, managerial leadership, supporting those individuals with the challenges that life throws at us, particularly as we start to get a little bit older as well, but not just those of us that are a little bit older, and how we can build that package of support into supporting our trainees who might find difficulties, whether that be in the workplace, the training, or home, thinking about how we can maybe make adjustments within the workplace to support individuals in that. I don't know what others' experience has been, but certainly within our team we've had a few cases of neurodivergence that have only been diagnosed since they started their master's programme, because they've managed to deal with their neurodivergence and work with it for all of the previous career, but when they get that master's, so the clinical, the academic, all of the pressures coming together, they can start to struggle, and that's when the diagnosis come out. So our practice support and wellbeing lead is very much embedded within supporting those individuals and anybody else who just needs some support and help to get them through a blip in training, because we invest a lot of money in our ACPs, and not just, if you only thought about the cost of the apprenticeship, it's £12,000, but then all the supervision that wraps around it, when you start adding those costs in, we're not a cheap workforce solution at all. We're a quality workforce solution, but we're not cheap. So investing in some of these roles, we are hoping to demonstrate that actually they are cost effective, and the benefits of keeping these individuals within their ACP training programme, or indeed if they aren't suitable, making sure that they're supported to find the route that they are suitable for, because advanced practice isn't for everybody. There are lots of other roles out there, and I think sometimes it's important to note that if it isn't the right thing for somebody, that we can support people to find alternative solutions for, or alternative roles that they might want to work within. Next slide, please, Karen. So within Derbyshire, we work very much as a county. We've had a Derbyshire collaborative group for, about 10 years now, that we have our most recent county-wide strategy that we've now developed, and capability and delivering a capable workforce is very much one of our work streams within there. So supervision sits heavily within that, and we're looking at taking the supervision and assessment roles that we've got working within UHDB, that roaming supervision aspect of that, to say, well, actually, can we help support some of the ACPs working out in our community services with some of the acute skills, because that's our area of expertise. And likewise, as we start to look at virtual wards and place-based care, can our community ACPs support and mentor some of our acute ACPs that are less familiar with working outside of the four walls of our safe and secure trust that I'm sat in today. And that's one of our key work streams within our county-wide strategy. We also delivered Derbyshire ACP Sim. I think this feeds back really, really well. So this is a sim day that's open to anybody who works as an ACP throughout the whole of Derbyshire. So we get a real mix of individuals in there. So people from community, from primary care, from acute care. And I think there's a real buzz within the room by the end of the day. I think there's lots of nervousness and anxiety when it starts off. I don't think anybody likes the feeling of being watched when they're doing something, but actually that ability of our ACPs, not just to get some reassurance that actually they are capable and competent, but also network with others, hear what's going on outside of the four walls of their area of work, and just share some of their experiences. And we try to make it so that it follows the patient through. So it might start in primary care, and then they might go to acute care, and then they might end up in a community hospital. So there's that flavour of everybody understanding where everybody else's bit fits into that patient's journey. And I think our next one is December the 5th. They're always well attended. There's a bit of human factors thrown in there, and they feed back really well. And then I had to leave my little car on there. So county-wide CARP, so CARP stands for Clinical and Academic Review of Progression. We have our annual portfolio reviews within our trust. However, for sign-off of completion of training, all of our ACPs across Derbyshire, of our organisations that signed up to it, have to submit their portfolio to external panel. And on that panel sits a group of Derbyshire ACP leads, our education leads sit on there, and also we have lay representation on that panel, which I think is key, so that we're being kept in line and everything is fair and due process is followed. And that will review the individual's portfolios. They will get an outcome from that, and they're all hoping for an outcome 6, which is completion of training. But if it isn't an outcome 6, then they're given supportive feedback to get them to the place that they need to be. We're very keen in Derby that actually the MSc sits alongside that clinical assessment in the workplace, and our ACPs don't qualify until they've got both of those in place. So their Masters in Advanced Practice alongside their portfolio of evidence. And I've left the car on there because up until this month, there's been a lot of driving around the Derbyshire countryside and lots of meeting in car parks and sharing folders and portfolios, because we've been on a paper-based portfolio. Yesterday we had our webinar launching our e-portfolio, which has been a long time coming, but it feels like it's revolutionary, and it's going to make so much difference to how CARP's facilitated and how much easier it's going to be for everybody going forward. So yeah, and I think that is my last slide. So it was just a very quick whistle-stop tour about what we've been doing, how we've been spending our money, and more than happy to take any questions if there are any.
Thank you, Jenny, that's brilliant. Obviously, I'm slightly biased towards UHDB, but I think the supervision roles are working out really well, though, aren't they? Just in terms of they're doing out of hours stuff as well with the hospital at night team, which I think has just made a huge difference for actually getting some of the work-based stuff done, hasn't it? Because
yeah, absolutely.
As much as I love my job, I don't tend to stay late in the evening to catch the hospital at night crew. So I think just sort of simple things like that were relatively easy to put in place, but have just made a huge difference, isn't it? So meaning everybody's getting that parity with a supervision across the board now. Absolutely. I think, yeah.
I think the other key thing for the ACP being in that supervision role is that they understand the training programme, they understand what an ACP looks like as a qualified ACP. I think previously there's been some challenges within our consultant body have been amazing, and we wouldn't have got to where we were without that supervision from our consultants over the years. But there is still that, oh, you know that and you're a nurse, that's really good. And it's like, no, it's not, that's just basic. I should know that. That's just basic foundation knowledge. So having that individual that can not only role model the role of the ACP to those trainees, but also know what the standard is and have that understanding of the standard as being really beneficial, I personally feel.
And I think sort of working closely with a PSW lead as well has made a difference too, hasn't it, with that sort of pastoral element of supervision and sort of really focusing on that side of things as well. It's not just standing at someone's bedside with a clipboard ticking them off for doing a respiratory examination. There's a whole lot more to supervision, and hopefully sort of across the board we're covering a lot of that with some of the things that we're doing at Derby. Are you okay to stay for a bit longer for the questions at the end?
I'll knock my camera off and type my notes up, but I'll be here.
Brilliant, thank you. Sadly, James Pratt was supposed to be coming as well from NUH to talk about the things that they're doing over there, but I think they're having a few issues at the moment, so he was hoping to make it, but doesn't look like he's been able to get across to us. Simon College, who's one of the practitioners over at Nottingham, I think did a session at the national conference recently about some of the things they were doing with their supervision money, and I'd say if you weren't in attendance, it's well worth catching it on the recordings and having a look at that, because they're doing some really good stuff over there. They're using some of their supervision monies into some sort of supernumerary supervision roles. So some of their qualified who they're all based in the emergency department, not spread across the trust, but are open to all trainees across the trust to come down. Somebody will be allocated today purely for supervision of trainees, and there's an electronic sign up, so I think they can take up to about 4 trainees, but don't quote me on that. And they'll sign up. They might want to look at something specific, they might want to just come and focus on, you know, the examination side of things, or they might want to see a patient. Apologies for my doorbell going then. They might want to see a patient together and then sort of do it as a one big case all together, or, you know, they can sort of practice on just clinical skills as well. I think they're evaluating that over sort of 3 aspects really. Obviously from a trainee satisfaction point of view, and what a difference it's making having somebody there just to supervise them for a session and do some of those things they're not always able to get somebody to do with them. Also from a kind of consultant or senior doctor point of view, how's that been with taking some of the pressure off them to provide all of that supervision as they were previously doing? And then I think most importantly, the looking at that actual supervisor well-being as well as part of it, and how is it that they can take that time out from their sort of pressured clinical day job and have a day of stepping back and spending it with trainees and perhaps doing something a bit different, as Jen was talking about the retention side of it as well, which I think would be really interesting to see the evaluation that comes out of that. So like I say, Simon's session will be on the national conference site, so do take a look at it, and hopefully James will be able to join us at another time to give you a bit more detail, but that's a little overview of sort of things that are happening over at Nottingham. So sort of in summary, I think, as it says there, it all really comes down to patient safety, doesn't it, Sarah? And that's what we're all here for. That's what we're trying to get the supervision up and running for, so we can look after our patients and look after our practitioners as well and give them the support and governance that they need. So thank you.
So question time. Heather has been looking at the chat for us, and if you want to ask a question when we're doing this, then you can pop your hand up and we'll be able to allow you to ask a question. Have we got any themes from the chat that we need to?
Yeah, so there's been a few questions coming in, and just like to say thank you to Saj and Jenny for sharing the work that they've been doing in their organisations, because I think that really makes it very real in how funding can actually be used and innovatively used to support supervision. So Saj, the first questions actually here is for you. Oh, actually no, the first question I think is a question for probably for Karen and Sarah, but I might be able to support a little bit with this question as well. And the questions from Mike is asking, what do you see the role of the primary care training hubs are within this agenda? So presumably that's within the supervision agenda. So I don't know who wants to take that one. Karen, you're nodding away there. Do you want to?
Yes, yeah. I know I shouldn't have nodded. Yeah, I mean, I think their role is going to be huge in kind of pulling all this together. And in the signposting point of view, we know that the trainees sometimes feel a bit isolated, don't they, out there in practice as well. So I think the training hubs for us going forward as well as a faculty, like I said, this is quite new for us too, and we are trying to build up that repository and signpost people to the right training. And I think the training hubs are really going to be instrumental in that. And I can see us working really closely as well to find out what needs there are out there in practice, feeding back up to us at regional level and seeing where we can fit in and support, because it's not a one size fits all, is it? We can't say that one bit of supervisor training is going to be perfect for Jen's team, it's going to be perfect for Sarge's team, it's going to be perfect for primary care. We know that's not the case, but I think the more knowledge we have as a regional faculty of what the need is, what's there, we can help people match that up, put people in touch with other training hubs as well, who perhaps are slightly ahead, or, you know, put them in touch with people who are perhaps a bit behind as well, and just try and bring everybody together a bit more so we can hopefully standardise things and people don't feel that they're alone, that they've got that support there as well. And I know I've met a couple of the sort of training hub leads as part of this role as well, and they're all feeling that the supervision is a key part. If they get the supervision right, then everything else hopefully falls into place So yeah, so in answer to that, a very big part, and I think we'll be working quite closely with you.
And I think I would absolutely agree with that. I think it really depends on the maturity of the training hub themselves and where they are on this journey towards developing advanced practice within the training hub. So obviously the employing practice is the one who is responsible for the trainee's scope of practice and for their employment and for providing the supervision, and the supervision funding will be made available to the practice, but the hub themselves can be there to support with that whole wider governance piece and ensuring that, you know, that they can be using that maturity matrix to be able to look at how they can support their practices within the hub in understanding advanced practice and in developing it appropriately, so that trainees do have appropriate and adequate supervision. And it just comes back down to that slide, that final slide that you put down. It is about patient safety and practitioner safety. It's ensuring that the services that we offer at advanced practice level are actually being delivered by appropriately trained and supervised staff. So I think, yes, I would agree with what you say there, Karen. I think the training hubs will have a big role in this, and we want to work with them to understand that. We're very lucky we've got Julia Taylor as our training programme lead in the Midlands region, who's really supporting with all of that work as well. So hopefully that sort of gives you a flavour, Mike, of some of the work that we're trying to do in primary care. So the next question that has come up is from Jonathan, and this is for Saj. And Jonathan's asking, Saj, did you have any difficulty in getting staff released to do the training?
Well, we got good. Well, we had a good qualified attending the training days. There is now difficulties being escalated to me, and there shouldn't be any difficulties. Don't be a difficulty to release everyone for the same day. We need to meet the service needs as well. But reasonable adjustments should be made, and the expectation is that everyone possible should attend the training days.
Thanks, Saj. I think we missed a little bit at the start of that answer because you're, I think there was a glitch in the matrix somewhere there, and we missed a little bit. So sorry, can I just, what you're saying is that it's about expectations. Is that what I was hearing?
Yeah, so the expectation is that all trainees attend the training days. The training days, obviously, we got depending on the topics and the subjects, people may choose not to come, or people may choose to come. So what I was saying was there is no difficulties being escalated to me. If there is any difficulties, or there shouldn't be any difficulties, and if there is any difficulty, and I'm happy to support our staff, our trainees in there, and the expectation is that all trainees come where possible.
So I think what I'm also hearing then from that is by having you in post as Director of Advanced Practice, it really helps to ensure that that agenda is being kept to the forefront. So that sort of, it seems to me to be a really good advert for that role if organisations don't have that within their structures. Thank you very much, Saj.
Yeah, it does help, and we have good support from the leadership executive, from the top senior trust lead, and we signed off the framework, and everything is in the framework, and that should happen in all areas now. It may take a bit of time because of the timing of the framework coming out, because we'll be behind the game, so it will happen, and like 3 hours non-clinical time, the supervision time, 0.25 SPA for the supervisors, and they're having the regular meetings. So these all should happen in all areas in the coming months.
Brilliant. That's really, really helpful. Thank you. And so then the next questions I think we've got are actually for you, Jenny. And Daniel's just asking that, first of all, just a quick practical question, really. He says, I'm interested in getting an educational ACP in post. Do you have a business case you'd be willing to share?
So we're not very good at business cases at UHDB. Claire and I tend to ask for forgiveness and not for permission, and we just took the supervision monies and presented it to our divisional directors to say, this is what this is what we're planning to do with it. These are the advantages of doing it this way rather than the way we've been doing it previously, and are you happy with that? And they agreed in essence. So I'm happy to have a chat with you about some of the stuff that we put into our argument to our divisional directors to get those posts in place, but I don't have a formal business case. I'll put my hands up.
And I think really following on from that, actually, and it's a really good question from Daniel, is because it is related to this, is how long is the supervision funding likely to be in place?
So for us, we have obviously recently got the HE supervision funding, so that's been a big bonus, but actually it's always been a caveat to us continuing to develop the ACP workforce. And prior to us having the HE supervision funding, which is what we've used for these roles, we were receiving funding from our workforce development group, because we were very clear that without supervision and funding for our supervision, we can't train a workforce, because it has to be there. It is the key element for developing the clinical workforce that we need. You would never train any other healthcare professional without supervision in the workplace, so why should ACP be any different? And we were fortunate that we managed to get that year on year for each of our trainees. So yeah, that's kind of how we managed to get it in place prior.
Yeah, and I think from an HE perspective as well, in answer to Daniel's question, any funding that we provide for supervision and so on is done on a year-by-year basis, so we will never be able to fully guarantee. We obviously put the case forward and make the case that this is supporting our trainees out in practice, but we don't get our actual final budgets until March, and that depends on everything from governments to what's happening. You know, we are a governmental body, and so depending on all of those decisions that are taken depends on whether we get the funding. So, you know, we are doing everything to make sure that that stays in place, but I would never be able to sit here and honestly say to you that I can guarantee that you will have that funding for X number of years, because that isn't something that I know, and it is the world that we live in, unfortunately. So thank you for that. So I've got a question here from Saravana. She said, I just want to get the numbers right. The trainee will be attending uni by one day, 1 hour supervision per week, tripartite meeting once every 12 weeks, and a day with a mentor. Are these Are these the right numbers, or am I missing anything? I think we might have to just think about that one. I might have to sit down and work that one all out, actually. So maybe what I would suggest is, rather than us trying to kind of unpick all of that in this session, Saravana, could we ask you to drop us an email into our AP inquiries, and we'll forward it on to Karen and Sarah, and they can answer and address your question much more fully. Because I think it's quite a big question for with lots of bits to it, so I think we'd have to think about all of that. So thank you. So there aren't any other questions actually that are coming up, and there are just, you know,
Saj has got his hand up.
Oh, Saj has got his hand up. Saj, ask away.
No. Just looking at Sharon, I think she is from my trust, and I suggest you go through the framework which we recently published. Possibly that will answer all your questions from that.
Brilliant, thank you. There you go. Hopefully that's answered your question then, Saravana. You've actually got the actual horse's mouth here, so thank you very much, Saj. That's brilliant for answering that. And actually, you probably have Saj's email, so you can always drop him an email, I'm sure, if you've got any clarification questions for that. So just looking at the rest of the questions, giving everyone a few more minutes to add anything in. There's a lot going of people saying about the recording, and Halima is our technical whiz and will have that uploaded in the next week. We can't guarantee that will be up on the website tonight, but we will inform everybody once that is actually uploaded and ready. So please bear with us. We are obviously a very small faculty team who are managing lots and lots of different balls in the air. So we will get that up back to you as soon as we possibly can. There aren't any other questions that are coming through. I'm just looking at the questions that you received prior to this. I think you've answered all of those questions really well. So I don't think there's anything else, unless anyone else, there's no final questions coming through. So I think we can probably release everyone to the wild when you finish your last little bit.
Do you, Sarah and myself, we're always happy to chat supervision, you know, kind of that's what we're here for. We can put you in touch with the likes of Jenny, Sarge, James, you know, if we don't know the answers, we'll probably know somebody else who does. So do use us. So like I say, the email address will be coming up shortly as well for the faculty. So we're always happy to catch up over Teams or respond to anything by email. So do use us. We don't like being bored, do we, Sarah? So we're happy to keep busy.
Yeah, keep busy, and we've got another session next week, which the registration link went out on the first slide. This is more aimed towards the supervisors and the supervisees, but it's open to everyone if you want to come. And then there's just our contact details there for the Advanced Practice website, our email address to our Advanced Practice faculty. And just if any of you tweet, we have a few of us putting on some information about what's going on from the faculty from that point of view. So please do get in touch, contact us, send us information. Also, as well as looking for things, do let us know any examples of good practice that we can share across the region, because that's really important. I think setting up that community for everyone is something that we're definitely aiming to do a little bit more from the faculty. So that would be brilliant. And thank you for all attending and participating and listening to us.